goes for your body. One of the ways you can start doing that is through exercise, of course.
But with 3/4 of people not hitting the NHS target for weekly exercise and doctors cancelling 135,000 surgeries every year because patients aren't fit enough, Dr. Helen Walls here with a simple guide to get everyone off the sofa. Let's just start with why exercise is so important, Helen.
Exercise is really important, and I liked what we said there about it being because they're not fit enough. It's absolutely not just about weight loss, and that's what a lot of patients think when we mention exercise to them. I think we actually put people off exercise as doctors. I think the fact that we say exercise when actually, you know, we should just say get active, because the NHS recommendation is that we do 150 minutes a week of moderate intensity exercise, and moderate intensity means you can't sing but you can have a chat while you're doing that. And I think, you know, I've got patients that will say, well, I'm never going to meet that 150 minutes a week. It's huge. And that puts them off starting. But my message today is just start. You know, it doesn't matter whether you're walking or just doing, you know, going up and down your stairs, taking the stairs instead of the lift. Just build that extra activity into your day-to-day, because we know that if you are doing regular exercise, you can reduce your risk of early death by up to 30%. It reduces a whole host of chronic diseases, type 2 diabetes, coronary heart disease, stroke, but even some cancers. You know, 1 in 7 women will get cancer in their lifetime in the UK, and some of the breast cancers that I'm talking about, 1 in 7 women, that can be reduced by regular exercise by up to 20%. So it has really key physical benefits.
Yes.
But it's not just the physical benefits that we need to mention here. It's the mental health benefits and this self-esteem benefits that it can have. You know, just getting out, having some exercise, releasing those endorphins. So they're chemicals that are released in the brain when we exercise. You get your heart rate up a bit, you feel a bit warmer. You don't have to be pounding it in the gym. Just doing something, even vacuuming, gets your heart rate up, gets you a bit warmer. It releases endorphins in the brain, which are similar chemicals to what we get in antidepressants that improve people's mood, but not just mood, concentration, focus, reduce stress, improve sleep. So there's a whole host of benefits to exercise that, you know, we need to get across here. It's not all about weight loss, absolutely not.
I know, I always feel so much better. I might not feel like it at the time, but after a bit of exercise, you do feel like your mood is boosted, don't you? But I guess the important thing is to know how to do it safely, because it differs for everybody, doesn't it?
Yeah, and it's about being an individual in this. So where is your starting point? And as I said earlier, I think we do put people off by saying 150 minutes. Don't take it as that big step. Start today. Start with something small. If you're not used to exercising, you know, just start with very small things you can do, like I've mentioned. Build that into your day, because that will start to pick up and become a habit. And when things become a habit, they become easier to do. I think we have a little bit of a misconception about age being a barrier to exercise. So we get sort of about age 65, see patients saying, well, I'm getting on now, I'm not going to do exercise. It's really important that older people do at least move, because it improves balance, it improves flexibility, it improves bone strength. Simple things that you can have around your home. You don't need to go to a gym to do this. So if you've got things like tins in your cupboard, you know, if you're not, even if you're chair bound, if you're not somebody who can move around, you can still do some what we call resistance exercises. So using the muscles, contracting the muscles regularly, you can do it above your head, all sorts of things on the internet that show you exercises you can do with that. And it just gets you moving, and that's what it's all about.
Closer to home, Strictly Fitness. I know we talk about it.
Yeah.
My mum started doing Strictly Fitness. She'd never really exercised, but I've seen it myself, the difference in her because of mobility.
Absolutely.
Now she's able to walk the dog, my sister's dog, around the block. She couldn't have done that.
And I bet her balance is better. She's less likely to have a fall. She's less likely, therefore, to fracture a bone. I mean, fractured hips in older people are catastrophic. You know, we don't want to go there. So building these little things into your day can really, really reduce those risks.
What about those who may be told that they can't do that? You know, if someone's got a health condition, I'd imagine they'd have to get advice before starting anything.
Yeah, so this is a really tricky one because, you know, we sit here and we want people to exercise, but there is a caveat to this, particularly if you've got heart and lung conditions, because heart and lung conditions can mean that you really struggle to get your heart rate up, you struggle with your breathing when you're exercising. So I think if you are somebody who's struggling with long-term conditions like COPD, so chronic obstructive pulmonary disease, where you've got breathing issues, coronary heart disease, angina, where you might get chest pain if you push your heart rate up, it's important that you have that chat with your healthcare professional. And I know that can be hard to do for some people, but those people who are really poorly will be under usually a specialist or a rehabilitation clinic, and you can have those conversations about what's safe for you.
Or those people maybe waiting for an operation. It'd be slightly different advice for...
So that's another one, isn't it? We mentioned at the start about people being turned away being fit for surgery.
Yeah.
This is something I see commonly as a GP, because they've waited so long now to get to that point where they're offered an operation that they've become unfit, really, you know, because they might have a hip pain, a knee pain, they've not been able to exercise because they're waiting for that joint to be replaced. There are things you can do, but it's about not thinking about, oh gosh, I've got to do the 150 minutes of moderate exercise.
Yeah.
Start with what you can and build up gradually and take it really slowly and easily. Don't just write it off because you're not going to get where we've said you need to be.
Yeah, and there are actually some really good tools out there to help, aren't there?
Yeah, absolutely. You know, for those people who can get online, there's a really good app called Strava, which I'm sure many viewers have heard of. The great thing about this is you can compare yourself to others. If you're competitive, people feel a real sense of accomplishment. You can post your achievements. You can connect with people, and connecting with people has been shown to really improve our sticking power to exercise. Having that connection. There's another one called FitnessPal, MyFitnessPal, and that you can get your calories burned. You can look at your food in and your calories out, but obviously it's not all about weight loss.
And the BBC, they have the Couch to 5K app, don't they? That's actually relaunching today.
Yeah, so 7 million people have downloaded this, so many people will have already heard about this. It can get you running from the couch 5K within 9 weeks, and it's a really supportive app. It helps you to know when to walk, when to run, when to take a breath. It can just build up that fitness really slowly, and as you said, you can download it as the app.
We saw some people setting off this morning on breakfast.
Yes.
Morning Live team on and off camera going to get involved with this. We want you to get involved too. Yvonne already started it.
You're on it, Yvonne.
I have, yeah. Downloaded in November. I've got a forthcoming exhibition to Peru, so I thought I need to get on it. And adapted it